Welcome, everybody. We are here today on the 7th of September, together in this room for the webinar presented by Dr. Powell, which is on adult spina bifida strategies for prevention and long-term rehabilitation. I am Dr. Reena Desai. I am the owner for Physiotherapy Online, which is a premier organization that provides a continuing professional development to physiotherapists globally. We've got students ranging all the way from Nigeria to Saudi Arabia to Yemen to India to Pakistan to UK and all over. And similarly, our lecturers, they come from various corners of the world as well, which is very interesting for the students and the lecturers alike, that we get to know each other. While you're here, I would want you guys to know that we send out clinical newsletters every month. So make sure you are registered on our website on physiotherapyonline.net. Also, what we do is we try the best to provide as cheap and affordable as possible or nearly free webinars to all the physiotherapists globally. In order to make the courses affordable and accessible, what we have is another website which is called Smart PT Academy, and that website basically shows you more currency options which are made affordable in your currency. For example, 20 Great British Pounds will not show up as 2,000 Indian rupees, but it might show up as 500 Indian rupees or 700 Indian rupees. All our courses, they meet the CPD standards that are adopted globally from various physiotherapy associations, so that our certificate, our education, our format of courses are accepted globally in your organization. Without further ado, what I would like to do is introduce Dr. Powell here. Dr. Powell Sasirki is a clinical specialist in neurophysiotherapy with master's degree from the University of Physical Education in Wrocław in Poland. He has a significant experience in treating complex neurological conditions and has enhanced his expertise in the UK through internships and prestigious institutions. Powell has worked with elite athletes, provided specialist rehabilitation at Focus Birmingham, and contributed to education and training in his field. He is registered with the HCPC and he's a member of the Chartered Society of Physiotherapy. At this point, I would like to hand over to Dr. Powell. Welcome, Dr. Powell, to your show.
Hello, good morning, good afternoon, and good evening. I'm not sure where you're sitting right now. Hello, everyone. Thank you very much, Dr. Reena, for introduction. Well, let's start with the really quick disclaimer. This training is about adult spina bifida. Yeah, we'll touch a little bit about childhood. Why is the spina bifida appears? However, this is strategies for the adults, and I would like you to take this take this in account. Yeah, that's purely for the for the adults. We'll go. Oh gosh, I need to change the slides. Physiotherapy Online, please get yourself familiar with all these instructions. Reena ask, please mute your microphones. We'll answer your questions at the end. Okay, there's no problem. We've got allocated time for that. And as Reena said, all the instructions you will have in your emails. Following that, I just would like to mention that I do receive a honorarium for presenting this course. even if it's for free for you. We're doing that very, very kind of, we try to concentrate on the on the quality, and to give you opportunity to experience something which you might not for the topics which might be completely new for you. I have no relationship to disclose any others. This learning event does not focus exclusively on any specific product or service, which is very important. And we're not selling anything, and there's no external sponsor for this course. It's purely us doing that. Also, I just go quickly through the course learning objectives. I hope after my presentation you will be able to identify and explain various types of spina bifida, their associated complications, and the factors that influence the severity and prognosis of the condition, enabling a comprehensive understanding of the patient needs. I hope you've seen that learning objectives before, but I just wanted to make sure we'll go through them. Second learning objective is you will be able to utilize diagnostic and functional assessment tools effectively to gather critical information on the physical, neurological, and cognitive impacts of spina bifida, ensuring your accurate evaluation for each patient you treat. You will be able to design and implement individualized rehabilitation plans, focusing on the maintaining and improving motor functions, addressing muscle weakness and joint contractures, and mobility impairments, while preventing complications such as skin ulcers or bone density loss. As well, you will be able to assess long-term impact of rehabilitation and physical activities on individuals with spina bifida, optimizing therapeutic interventions and physical activities recommendation to enhance patient quality of life and functional independence. I'm reading this exactly as it is, as we want to make sure that that is really clear. That on the point 5 you will be able to define physioprophylactics. I hope it's not new concept for you, physioprophylaxis, but I will present it for you, the idea behind that. I hope you will be able to identify its different phases of physioprophylactics and to describe appropriate physiotherapeutic measures for each phase, aiming to prevent, slow down, or mitigate the development of functional health